Okay, so my topic is Epstein-Barr virus and multiple sclerosis, or MS. So Epstein-Barr virus is a member of the herpes family. It's called human herpesvirus 4. Epstein-Barr virus is transmitted through bodily fluids, usually saliva. It could also be transmitted through blood and semen, though. Epstein-Barr virus is extremely common in people. Around about 90% of people will have it in their lifetime. Epstein-Barr virus can cause symptoms or it may not. If people are symptomatic, usually that'll include fever, fatigue, headache, and a sore throat. After a few weeks, this EBV goes latent in the body, but if it does reactivate, it can become transmissible again. So there are many diseases associated with Epstein-Barr virus. The first is infectious mononucleosis, or mono, also known as the kissing disease, because it's caused by saliva transmission. Rare cancers including Hodgkin's lymphoma, CAEBV, or chronic active EBV. We're now realizing that schizophrenia is associated with Epstein-Barr virus, as well as many autoimmune disorders like lupus and rheumatoid arthritis, and now MS. So when Epstein-Barr virus interacts with the immune system, it infects the B cells of the immune system. When it infects these B cells, it uses their machinery to replicate, and that persists in the memory of these B cells. So the T cells of the immune system respond to this infection of the B cells. So they create a T cell response, which is associated with mono. And EBV is actually thought to cause the autoimmune response by interplay between genetic predisposition and EBV infection, which leads to the development of cross-reacting antibodies and later the non-cross-reactive antibodies against autoepitopes. So it has to do as well with your genetic predisposition, whether it's going to cause that autoimmune response. So MS is a disease of the central nervous system. And when you have MS, your immune system attacks nerve fibers in the myelin sheathing of neurons. So there are various types of MS. Some of those include relapse-remitting MS, primary progressive MS, secondary progressive MS, and benign MS. Okay, so relapsing remitting MS is usually how MS starts, and it's the most common form of MS. When somebody has relapsing remitting MS, typically their symptoms will occur over a course of weeks, and then once that MS goes into remission, these symptoms will partially or completely disappear. Relapses of this form of MS will occur where symptoms become active again. These other forms of MS include secondary progressive MS, which begins with RRMS, relapse remitting, and in SPMS, there are no longer periods of relapse and remission, just constant lingering symptoms, which may be less bad than when there's a relapse, but still present, unlike if somebody was in remission. So if somebody has primary progressive MS, they have a gradual decline in mobility. Benign MS is when somebody has had MS for about 15 years, and 15 years after that diagnosis, mild symptoms will appear. So the relationship between EBV and MS does seem to be a causal one. This was discovered in a longitudinal study conducted by Harvard researchers on members of the military, where they found risk of MS increased 32-fold after infection with EBV, but when people had other viruses, the risk was unchanged. So it seems as though, although EBV infection is extremely common and MS is rare, it is difficult to explain MS with any other risk factors. And MS biomarkers were found only in people who also had EBV. It's still unclear how EBV causes MS. MS symptoms don't appear until about 10 years after the infection with EBV. However, it's important to note that MS's symptoms go undetected when somebody first has it, so it's unclear how soon after somebody is infected with EBV that MS actually appears. And the cause is most likely due to an evolving relationship between the virus and the host immune system. So now that we know that there's a relationship between MS and EBV, we can target EBV in order to treat MS. So hopefully EBV vaccines will be developed to prevent MS. And there will be antivirals that target EBV, because currently there's no way to treat it. Hopefully now that the relationship has been discovered, we can develop medications to ultimately prevent or cure MS.